Have you ever wondered what would happen if your cat were calling for help and you didn't realize it? Picture a normal day. Your Royal Highness strolls around the house, eyes a bit glassy with a soft, unusual meow. It's easy to brush off and think your cat is just being quirky. But wait, this could be an early warning sign of something serious. The scary truth is that cats, even indoor pets, are masters at hiding illness. In the wild, showing weakness makes them targets, so cats learn to suffer in silence. That means we humans often don't notice a problem until it's too late. You think a cat will whine or cry like a dog when it hurts? Not really. Cats often act fine. They can even purr while in pain as a self-soothing mechanism. This dangerous quietness makes many owners underestimate the situation. The result? Hidden diseases keep progressing. Too many people are stunned to find their cat has a late-stage illness simply because the early signs were missed. A 2024 study in a veterinary behavior journal identified 7 key behaviors that signal illness, and humans commonly overlook them. Those are the 7 warning signs we're about to explore. Get ready. What you're about to hear could save your cat's life or at least help you understand them better than ever. A cat lies curled up with tired eyes. Would you notice that something's wrong? Earlier this year, the cat community in Vietnam was shaken by the story of Ms. A and her cat, Bo. Normally, Bo was a healthy little monarch with glossy fur and a great appetite. Then, over a few months, Bo slowly began to lose weight, so gradually that no one paid attention. He started vomiting on and off. Some days he even brought up hairballs, which she assumed were just routine tummy upsets. Bo also became quieter and preferred to hide in a corner. She casually thought he was just older and crankier, so she didn't take him in. One night, Bo vomited repeatedly, stopped eating, and lay there breathing hard. Panicking, she rushed her boss to the ER. What the vet said left her numb. Bo might have late-stage cancer. A large abdominal mass was preventing him from digesting food. The earlier weight loss and vomiting had been cries for help that went unnoticed. Bo's case isn't rare. Another owner once shared that his cat kept urinating outside the litter box, just a few drops, and cried out while doing it. Thinking the cat was misbehaving, he scolded him and let it go. Only 48 hours later, he found his cat collapsed with a swollen, firm belly. At the clinic, it was too late. The cat had a severe urinary blockage, a condition that can be fatal within 24 to 48 hours if not treated in time. A blocked bladder traps toxins in the blood, causes extreme pain, and can quickly lead to kidney failure. Had he recognized the early signs, straining to pee, going outside the box, he could have saved his little friend. Stories like these are a powerful reminder. Every unusual signal from a cat deserves attention. A single moment of complacency can cost your Royal Highness their health or their life. From Bo's case to the blocked cat tragedy, it's painfully clear how ignoring warning signs can end in regretful, too-late decisions and heartbreaking outcomes. Why do we, loving, devoted cat parents, so often miss the warning signs? The answer lies in both feline instinct and human perception. On the cat side, their evolutionary heritage is to hide illness. Wild ancestors lived solo. Showing weakness made them easy prey for larger hunters like wolves or hawks. So, cats learned to fake being fine to survive. Even today, a sick house cat may simply curl up in a corner and look calm instead of crying out. Even with their trusted humans, many cats won't fully show pain. You'll rarely see obvious limping. They'll cocoon their discomfort, revealing it only through subtle shifts, reduced appetite, sluggishness, or avoidance. These tiny changes are easy to overlook or misread. For example, purring isn't just happiness. Sometimes cats purr to self-soothe when they're hurt or scared. If you don't know that, you might think, oh, she's purring, so she must be fine, when she's actually coping with pain. And that blank or distant gaze? Many people assume it's a sleepy, chill mood, but it can signal pain and exhaustion. Cats in pain may stare into space with dull, unfocused eyes. To make things harder, cats rarely cry out, even when very ill, which makes owners even more complacent. Veterinarians acknowledge that people miss feline pain signals more often than canine ones because cats are quieter and their facial expressions are more subtle. There's even a feline grimace scale to score pain from details like ear position and narrowed eyes, signals most owners won't catch reliably without training. In short, differences in body language plus a built-in hide-the-illness instinct create a big information gap between cats and humans. Unless we actively learn to read cats, their quiet warnings will keep getting lost until consequences become obvious. But don't worry, you can close that gap. First, let's learn the 7 most important warning signs distilled from veterinary experience and the cat parent community so you never miss your cat's messages again. These are the 7 red flags every cat parent should memorize. For each one, we'll cover 4 parts: what it looks like, the behavioral/evolutionary explanation, why cats do this, what it means for you, what your cat is saying, and action steps, how you should respond. Remember, every cat is different, but if you see any of these signs, never ignore them. Sign 1. Changes in appetite or drinking habits. What it looks like. Your cat suddenly stops eating, eats much less than usual, even rejects favorite foods. Or the opposite, eats more than usual, yet keeps losing weight. You may also notice much more drinking than normal, licking for water constantly or drinking from odd places, toilet, faucet. Sometimes the cat barely touches water and the bowl stays full all day. Behavioral/evolutionary explanation. Desert-adapted ancestors got water from prey, so heavy drinking is unusual and often means dehydration or illness. Healthy cats rarely refuse food. Survival drives them to eat. Stopping signals pain, fever, or a disorder affecting appetite. Eating a lot while losing weight suggests a metabolic issue like hyperthyroidism. What it means for you? Loss of appetite can point to dental pain, gum disease, liver, kidney disease, or cancer. Sudden increased thirst often signals diabetes or kidney disease in seniors. Very low water intake risks dehydration or stones. Eating plenty with weight loss can mean hyperthyroidism, parasites, or cancer. Act fast. Try warming food or flavor changes, but don't delay a vet visit if there's no improvement. Sign 2. Sudden weight loss or gain. What it looks like. Noticeable thinning, feeling spine or ribs, a sunken belly, or the reverse, a quick belly pop and 2 kilograms gain without diet change. Gradual shifts may only be obvious when lifting your cat. Behavioral/evolutionary explanation. Weight loss in the wild is dangerous. Visible loss means illness is overwhelming survival drives. Rapid gain is rare outside domestic life and can reflect hormones or inactivity. Because cats are small, even 0.5 kilograms is significant. What it means for you. Weight loss often signals hyperthyroidism, diabetes, cancer, or kidney disease. Rapid gain may be fluid from heart or liver disease or an abdominal mass. Even small percentage changes are meaningful. Action steps. Weigh monthly. If weight shifts greater than 5% in 1 to 2 months, see your vet. Blood work and ultrasound can reveal causes. Check the mouth for dental pain. If gaining, audit calories and increase play. Obesity drives diabetes and arthritis. Don't wait for extremes. Early workups improve outcomes. Sign 3. Hiding or withdrawing much more than usual. What it looks like. A social cat suddenly vanishes into closets, under beds, or dark corners. Calls don't work, and pushing contact triggers growls. Aloof cats hide even more, often paired with lethargy. Behavioral/evolutionary explanation. Sick cats instinctively hide to avoid predators and conserve energy. House cats keep this reflex. What it means for you? Early sign of many issues: chronic pain, infection, heart or respiratory problems, or psychological stress. Neglected grooming alongside hiding suggests low energy or pain. Action steps. Remove obvious stressors. If hiding persists, schedule a vet exam. Observe hiding spots and posture for pain clues. Don't forcibly drag them out. Use gentle coaxing and create a safe room. Trust your gut if something feels off. Sign 4.
changes in litter habits, accidents, straining, etc. What it looks like? Peeing or pooping outside the box, lingering and straining in the box, tiny amounts, crying, blood in urine, diarrhea or hard stools. Any shift in frequency, volume, or location is a red flag. Behavioral evolutionary explanation. Cats are clean and bury waste. Avoiding the box may mean they associate it with pain, urinary inflammation, or they're anxious and marking. Straining signals functional trouble. What it means for you? Don't scold, this may be urgent. Medical causes include urinary inflammation, stones, or male urethral blockage, a life-threatening emergency. Diarrhea can reflect GI upset or parasites. Severe constipation can be dehydration or hair accumulation. Stress can also play a role. Action steps? Vet first. Immediately if straining, blood, or inability to urinate. Bring stool or urine details or photos. Keep boxes pristine, add extras for multi-level homes, stick to familiar litter, and ensure fresh water. Address stress only after ruling out medical causes. Sign 5. Frequent vomiting or excessive hairballs. What it looks like? Vomiting several times a week or daily, undigested food, yellow foam or blood, giant hairballs more than 1 to 2 times per month, ratching without results. Behavioral evolutionary explanation. Expelling hair prevents blockages, but frequent vomiting isn't normal and leads to dehydration and weakness. What it means for you? Could indicate gastritis, food intolerance, partial obstruction, pancreatitis, bile reflux, ulcers, or overgrooming from itch or stress. Cats just vomit is a myth. Action steps? Log episodes and see the vet if it lasts beyond a day or recurs often. Imaging may rule out foreign bodies. Bring samples or photos. Brief fasting 6 to 12 hours can rest the stomach, but don't prolong. Brush regularly, consider hairball aids or diet trials, and feed smaller, frequent meals. Seek veterinary care if adjustments don't help. Sign 6. Changes in grooming and coat condition. What it looks like? Matted, greasy fur, dandruff, tangles, or stopping grooming altogether. Or over-grooming one spot to baldness and red skin. Posture shifts like hunching, tucked tail, or pinned ears. Behavioral evolutionary explanation. Grooming is essential for cleanliness, circulation, and low scent. Stopping often means pain or weakness. Overgrooming is commonly itch or stress self-soothing. What it means for you? Coat condition mirrors health. Arthritis, obesity, or dental pain can block grooming and trigger skin issues. Bald patches often mean allergies or pain under the skin, e.g., bladder discomfort leading to belly licking. Stress can drive compulsive licking. Action steps? Inspect skin and coat regularly. Brush to help, but find the medical cause. Vets can identify arthritis, dental disease, parasites, infections, or allergies, and treat pain or itch so grooming normalizes. If stress remains after medical causes are excluded, address behavior. No punishment, more safe space, more daytime play, night lights for seniors, structured affection, and, when needed, short-term anxiety meds. Sign 7. Abnormal behavior shifts. Irritability, aggression, clinginess, unusual vocalization. What it looks like? A gentle cat turns aggressive, growling and swatting, resisting touch. An independent cat becomes clingy and needy. Some start meowing or yowling far more, strange tones, especially at night. Behavioral evolutionary explanation. Big personality shifts require big triggers: pain, fear, weakness, or neurological change. Clinginess can be insecurity or illness. Nighttime vocalization may be cognitive decline, pain, or effects of high blood pressure. What it means for you? Treat sudden aggression as a pain signal. Belly or spine pain often shows when touched or picked up. Clinginess can be anxiety, depression, or illness. Excessive vocalization can be hyperthyroidism, hypertension-related vision changes, or cognitive dysfunction. Action steps? Start with a vet exam and detailed history. Expect checks for pain, plus blood work for thyroid and kidney issues in seniors. If medical issues are ruled out, address behavior. No punishment, more safe space, more daytime play, night lights for seniors, structured affection, and, when needed, short-term anxiety meds. The stories and analysis above already show how tragic things can get when we shrug off a cat's signals. Let's sum up real-world consequences seen both in veterinary practice and by cat parents, so none of us has to learn the hard way. Advanced disease by the time you act. Cats hide symptoms, so many owners don't go to the vet until illness is severe. Some cancers can be managed if caught early, but too often tumors have already spread. What's left is pain control and preparing for goodbye. The regret, "if only I'd noticed sooner," is heartbreakingly common. Life-threatening emergencies. Many minor signs are actually early warnings. A male urinary blockage can be fatal in a day or 2 days. A cat that hasn't eaten for 2 to 3 days can develop acute fatty liver. Undiagnosed diabetes can cause hypoglycemic collapse and seizures. Most of these crises are preventable if we heed early signs like straining to pee, skipping meals, or sudden weight loss. Prolonged unnecessary suffering. Without our recognition, cats endure chronic pain for weeks or months, severe dental disease, ear or skin infections, and more. Quality of life plummets while they suffer in silence. Higher treatment costs and emotional toll. Late-stage care is expensive and often less successful. Early detection is usually simpler and cheaper. The guilt of missing early clues can be crushing. Risk to other pets and people. Contagious problems, ringworm, parasites, or viral colds can spread to other cats and sometimes to humans. Early action prevents household-wide outbreaks. Bottom line, early detection gives almost every condition a path to treatment or meaningful improvement. Late detection shrinks the odds. Stay alert to even small changes so you're never the villain in your own sad story. How do you become a sharp-eyed cat parent who never misses even the tiniest signal? No one understands cat language 100%, but you can train your sensitivity with the steps below to build a closer, more intuitive bond with your cat. Know your cat's normal. Learn daily baselines: food, water, sleep spots, playtimes, gait, and jumps. Keep quick notes or short videos. With a baseline, deviations pop out. Small changes matter because cats hide discomfort. Do simple at-home health checks. Weekly, while brushing, check ears, eyes, mouth, skin, coat, and paws. Palpate gently for ouch spots. Weigh monthly. You'll catch early clues and teach your cat to tolerate handling. Strengthen the bond through play and observation. Daily play reveals agility and breathing. Cuddles reveal tender areas and even small lumps. Talk to your cat. Tone and attention build trust, and you'll notice sound changes faster. Learn feline body language. Tail flicks, ear positions, pupil size. Know the basics so you don't misread signals. Knowledge helps you act sooner and respond correctly. Create a safe and comfortable environment. Quiet zones, vertical space, hideouts, and predictable routines reduce stress. In a secure territory, health-related changes stand out. Good environments also prevent issues like obesity and stress-linked bladder problems. Don't hesitate to ask the pros. Do regular vet checks, annually or every 6 months for cats over 7. If behavior is off but tests are clean, a feline behaviorist can help. Prevention isn't overreacting, it's smart care. In short, sensitivity equals love and knowledge. The more you observe and empathize, the more a near sixth sense develops. One glance tells you if your cat is okay. Remember this, your cat can't speak human, but they're always talking to you with their body and behavior. Every look, every sound, every shift in routine carries a message. As your cat's person, you have both the privilege and the responsibility to listen. Don't wait until your cat is crying in pain or collapses. By then, it may be too late. Become the friend who understands the tiniest signs, because in those small details, we show real love and care. Ask yourself, is my cat okay today? What's different from yesterday? One simple daily question, paired with open eyes and ears, can transform your pet's life. If you've spotted unusual signs and helped your cat through illness, share your story. Your experience can help countless other cat parents, because we learn from each other to care better for our feline friends. Leave a comment with the sign you noticed, how you handled it, or any tips for decoding your Royal Highness. Don't forget to spread the knowledge. If this video helped, please like and share it with fellow cat parents. You might literally help save a cat when an owner recognizes a warning in time. If you want to go deeper, we've prepared another video on how cats show affection and needs. Tap to learn more. In a cat's world, the quiet heroes are the humans who listen. We hope you're ready to become a savvy guardian who never overlooks a cry for help. Let's keep our Royal Highnesses healthy and happy for a very long time. Thanks for staying to the end. Give your cat a big hug for us and check out more useful content on the channel. Wishing you and your beloved cat a life full of understanding and love.